Welcome to the ASCO eLearning Weekly Podcast, a weekly educational series focused on helping learners identify knowledge gaps and stay up to date with the latest in new drug developments, cancer treatments, and patient care approaches. This episode is complimentary to an education session presented at the 2019 annual meeting. For more detailed information about the education session, make sure to check the episode description for links to ASCO's meeting library.
Welcome to the ASCO eLearning Weekly Podcast. My name is Dan George, and I'm a professor of medicine and surgery at Duke University and co-chair of the Duke Cancer Institute Center for Prostate and Urologic Cancers. I'm presenting today on the topic All Men Are Created Equal, Addressing Disparities in Prostate Cancer Care. And I'll start by highlighting a case of advanced prostate cancer to focus on the impact of race on outcomes. But first, let's review the epidemiology of race and prostate cancer. African American men are 1.5 times more likely to develop prostate cancer in the United States than other races, particularly Caucasian. In addition, African Americans are 2.5 times more likely to die from this disease. And the reason for that cancer disparity is multifactorial, having to do with both socio and economic factors, as well as cultural and biologic factors as well. Recognizing this disparity and this higher risk of cancer death is critical to our management of these patients. But equally important is understanding their response to therapies. So let's start with a case. Our gentleman today is a 68-year-old African American man who presented with back pain, was found to have high-grade prostate cancer with a PSA over 200 and multiple bony metastases. He was treated initially with hormonal therapy, androgen deprivation therapy, or ADT, and docetaxel chemotherapy for 6 cycles. This was followed by continuous androgen deprivation therapy, and he was stable on this treatment for about 2 years when his PSA began to rise again, consistent with early metastatic castration-resistant prostate cancer. Aside for some chronic fatigue and hot flashes, he was clinically stable. So what treatment options would you consider for this patient? The options would be Number 1, oral hormonal therapy with abiraterone or enzalutamide. Number 2, sipuleucel-T, a novel immunotherapy for prostate cancer. Option 3, radium-223, a novel radiopharmaceutical for this disease. Option number 4, chemotherapy with either docetaxel or cabazitaxel chemotherapy. Well, I'm happy to report the answer to this question is all of the above. And the reason for that is due to a lot of data that's recently come out regarding the management of patients with advanced prostate cancer by race. Historically, we viewed these patients as being underrepresented on clinical trials, and that's true still today, and there's a major limitations to our analyses. But in the case of abiraterone and enzalutamide, we've been able to look at retrospective data, both from clinical trials as well as from single-payer health systems, to suggest that African American patients might actually respond better to abiraterone and enzalutamide. In addition, we presented at ASCO a prospective study, multi-center study, of 100 patients treated with abiraterone, 50 African American and 50 white patients at centers across the United States, and demonstrated about a 40% improvement in the time to PSA progression in favor of the African American population. We're currently undergoing follow-up studies to confirm these results with additional novel hormonal therapies. But it suggests that this population of patients may actually be more responsive to novel hormonal therapies. In addition, Oliver Sartor presented at AUA in 2017 a retrospective case control analysis from the PROCEED registry of advanced metastatic castration-resistant prostate cancer patients, matched for PSA, and a 2-to-1 case-controlled analysis demonstrated an improvement in overall survival in the African American cohort compared to white patients, with a greater than 1-year improvement in the median overall survival. This data is currently under review for publication. And then most recently published earlier this year in the journal JCO, Susan Halabi and colleagues presented a meta-analysis from multiple trials, 9 clinical trials, phase 3 studies involving docetaxel chemotherapy, and demonstrated overall for African Americans involved in those trials about a 20% improvement in overall survival compared to white cohorts. This data all suggests that these patients, despite having a more aggressive disease and presenting more often with higher stage disease and higher grade disease and a shorter time to metastasis, actually have as responsive or more responsive outcomes to therapy. Finally, radium-223 is least known by race, but is an agent that we know is active in patients that have bone-dominant disease. So in a patient such as this with bone-dominant disease, clear progression to castrate-resistant disease, a disease that is likely to take his life at some point in time, he's also likely to benefit from all of these therapies. And taking a proactive approach to treat this patient before symptoms come on is really critical to maximizing the outcome, not just with one treatment regimen, but with all possible treatment regimens. I'd like to end there and thank you for listening to this week's episode of the ASCO eLearning Weekly Podcast. For more information on All Men Are Created Equal, addressing disparities in prostate cancer care, visit the Comprehensive eLearning Center at elearning.asco.org.
Thank you for listening to this week's episode of the ASCO eLearning Weekly Podcast. To make us part of your weekly routine, click subscribe. Let us know what you think by leaving a review. For more information, visit the Comprehensive eLearning Center at elearning.asco.org. The purpose of this podcast is to educate and inform. This is not a substitute for medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.